Bipolar disorder. My name is Cynthia Johnson. I am a PSY student at the University of Arizona Global Campus. The course is PSY 7510, Biological Basis of Behavior. The professor is Dr. Liu, and the date is September 16th, 2023. My first slide is on why bipolar disorder interests me and how, as a child, they can be misunderstood with this disorder, as well as isolate and sit in silence because they're not sure what is going on with them. Bipolar disorder interests me because you cannot see the disorder and there are no physical symptoms. People often think that when a person appears to be happy, there is nothing wrong with them because they are nice, but they are trying to mask the fact that they are suffering in silence mentally. The audience I am presenting to are parents of children who suffer from bipolar disorder. The next slide is bipolar disorder symptoms. They can be anywhere from depression, mood swings to mania. In children and adolescents, it may be difficult to recognize the symptoms of bipolar disorder due to their normal behavior that could be caused by stress or the child being disobedient. However, if you notice that your child is constantly having extreme mood swings that are different from their typical mood, they are always sad and in a depressed mood. If that is the case, it may be time to schedule a doctor's appointment for a mental health assessment. The next slide is bipolar disorder diagnosis. The onset of bipolar disorder can occur at any age. The symptoms vary from person to person, and a parent would need to seek medical attention for a diagnosis. Mood disorders usually appear in the late adolescence or early adulthood. Bipolar disorder, also called manic depression, is a chronic and debilitating disorder. And compared to other mood disorders, it has a lower recovery rate and higher mortality rate. That is because there is no cure. So bipolar disorder must be managed throughout a person's lifetime. The next slide is underlying factors. The underlying factors can be genetic causes. It can be an injury to the brain or head injury or environmental changes. There are underlying factors that may contribute to a child's development of bipolar disorder. From a genetic standpoint, if a parent has been diagnosed with a mood disorder, the child may develop that same mood disorder or a different mood disorder, such as schizophrenia. Abnormalities in serotonin, norepinephrine, and dopamine may have been implicated in the cause of bipolar disorder. Serotonin activity is reduced in bipolar disorder, whereas norepinephrine activity is increased. Growing up in a toxic environment and experiencing childhood trauma is also an underlying factor for developing bipolar disorder. The next slide is on treatment. Treatment can consist of medication, therapy, and with the therapy, you're going to learn coping skills to deal with this disorder. Currently, there is no cure for bipolar disorder, and treatment throughout a person's lifetime is required to live a healthy life. Treatment of bipolar disorder has centered on relieving manic or depressive symptoms and providing prophylactic or preventive therapy. Lithium is used to treat manic symptoms. It also works as a prophylactic treatment, stabilizing mood and preventing the individual with bipolar disorder from cycling into a manic or depressive phase. A licensed mental health professional is going to prescribe the medication as well as provide therapy for the individual who has been diagnosed with bipolar disorder. Some coping skills that can be used to relieve the symptoms of bipolar disorder consist of listening to music, art therapy, or exercising, just to name a few. The next slide is medication. Should you use medication or psychotherapy or both? Lithium is a mood stabilizer that is used to treat severe cases of bipolar disorder where the person is experiencing suicidal thoughts. If lithium is not working, the healthcare provider may prescribe anticonvulsant medications. These medications can have adverse effects and alter the functioning of your thyroid and kidneys. A healthcare provider will recommend psychotherapy to a child first and slowly implement low dosages of mood stabilizing medications only if they feel there is no improvement with the psychotherapy by itself. The next slide is mental health stigma. People with mental health disorders are dangerous. That's one stigma. Another stigma is people with mental health disorders are in denial or they decline treatment. Another stigma, and this is coming from the person themselves, they have a negative self image and they may feel like their self worth is not as good as other people. People with disabilities are stigmatized, and those with mental health problems must fight both their pathology and the discrimination they suffer. There is a stigma often associated with mental health disorders in adults as well as in children. The other children may consider them inferior or different from the rest of the children. This will cause the child to have a negative self image. To counter this behavior, parents need to ensure that their child is attending therapy, taking their medication if prescribed, and asking for support from school counselors and teachers. The last slide is challenges and insights. My challenges for creating a PowerPoint presentation are many, as usual. I'm always concerned about the flow of the material and how well the information makes sense. The design of the presentation is a concern and whether the look is representative of the information being presented. The insight for me is you always learn new information about the topic you are researching. And I learned that bipolar disorder can be triggered by the environment you are raised in. I thought it had more to do with genetics and injury. However, childhood trauma caused by abuse, whether it is physical or emotional, can trigger the onset of bipolar disorder. This is the end of my PowerPoint presentation. I hope everyone enjoyed, and I hope I spoke in a clear and pleasant tone. Thank you for listening. Goodbye.